This is the muscle that's been stretched and I cannot stretch it anymore. So in many cases, or in some cases more likely, the lung and the heart will also be involved. In some cases, the gallbladder and the spleen will be involved, or let's say a major player within it. So, to sum it up, one must always palpate in frozen shoulder case. If somebody comes with a frozen shoulder, it's not enough to ask him show me where the pain is, or show me where the pain is with one finger. That is what I normally do with other shoulder problems. In frozen shoulder, I need to do the examination, and I need to also palpate. And I need to palpate areas that are not necessarily what the patient is complaining. So when somebody comes to my clinic, I don't just palpate the shoulder area. I palpate the lung area, I palpate the heart area, I palpate the intercostal muscle, the gallbladder, and the spleen. The difference is that if it's gallbladder, then the pain continues all the way up here. If it's spleens, then it stops, right? Because the spleen goes and it's like stops here. And I check, of course, the back and the bladder. How much is he involved in that particular case? Okay. Now, how do I treat it? Again, diagnosis. What's the next step? Finding a balance in meridian. So let me tell you a secret. Any of these two combinations, liver and spleen or liver and kidney, they treat all the meridians that are involved. So technically, if the problem goes more to the bladder part, I would do liver and kidney, because liver treats the large intestine, liver treats the lung, liver treats the small intestine, and then kidney will do the bladder, the heart, and the sanjiao. Okay, so I have them all. Well, of course, liver does the gallbladder too. If the problem does not involve the bladder line, I would go to liver and spleen. Okay, this is from my basic experience. But what points do I choose? So the points are like that. I would do the liver 4 towards 5 ashi, and then either adds 5 towards 7 ashi on the spleen. And if I use the kidney, I would do the same for the liver, and I would just use the kidney 3 towards 7, even a little bit higher than 7